Diabetes mellitus, commonly known as diabetes, is a metabolic disease that causes high blood sugar. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. With diabetes, the body either doesn't make enough insulin or can't effectively use the insulin it does make. In this phase, we shall be treating the cure to this dreadful diabetes. But before that, there is type 1 diabetes, which is an autoimmune disease. The immune system attacks and destroys cells in the pancreas where insulin is made. Type 2 diabetes occurs when your body becomes resistant to insulin and sugar builds up in your blood. In the case of type 1 diabetes, doctors don't know exactly what causes type 1 diabetes, but you are more likely to get type 1 diabetes if you are a child or a teenager and you have a parent or sibling with a condition, or you carry certain genes that are linked to the diseases. The autoimmune form of this type diabetes starts in childhood. One of the main symptoms is increased urination. Kids with type 1 diabetes may start wetting the bed after they have been toilet trained. Extreme thirst, fatigue, and hunger are also signs of the condition. The disease can cause high blood sugar and dehydration, which can be medical emergencies. Type 2 diabetes used to be called juvenile diabetes because type 2 was so rare in children. Now that more children are overweight or obese, type 2 diabetes is becoming more common in this age group. About 40% of children with type 2 diabetes don't have symptoms, and untreated type 2 diabetes can cause lifelong complications, including heart and kidney disease and blindness. But heavy eating and exercise can help your child manage their blood sugar and prevent these problems. This type of diabetes is more prevalent than ever in young people. Prediabetes occurs when your blood sugar is higher than normal, but it's not high enough for a diagnosis of type 2 diabetes. Gestational diabetes is high blood sugar during pregnancy. Insulin blocking hormones produced by the placenta cause this type of diabetes. Then a rare condition called diabetes insipidus is not related to diabetes mellitus. Although it has a similar name, it's a different condition in which your kidneys remove too much fluid from your body. Diabetes symptoms are caused by rising blood sugar, which include increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, sore that does not heal. The men with diabetes may have a decreased sex drive. They may have erectile dysfunction, ED, and poor muscle strength. Then women with diabetes can also have symptoms such as urinary tract infections, yeast infections, and dry, itchy skin. Different causes of diabetes are associated with each type of diabetes. Then doctors don't know exactly what causes type 1 diabetes. Genes may play a role in some people. It's also possible that a virus sets off the immune system attack. Then type 2 diabetes stems from a combination of genetics and lifestyle factors. Being overweight or obese increases your risk too. Carrying extra weight, especially in your belly, makes your cells more resistant to the effect of insulin in your blood sugar. Women who are overweight when they get pregnant, or who gain too much weight when they are pregnant, are more likely to get gestational diabetes. Neuropathy, nephropathy, foot damage, depression, stroke are complications associated with diabetes. Then uncontrolled gestational diabetes can lead to problems that affect both the mother and baby. Complications affecting the baby can include premature birth, higher than normal weight at birth, low blood sugar, jaundice, and so on. The mother can develop complications such as high blood pressure. She may also require cesarean delivery, commonly referred to as a C-section. The mother's risk of gestational diabetes in future pregnancies also increases. Diabetes can lead to serious medical complications, but you can manage the condition with medications and lifestyle changes. Doctors treat diabetes with a few different medications. Some of these drugs are taken by mouth, while others are available as injections. Insulin is the main treatment for type 1 diabetes. It replaces the hormone your body is not able to produce. diet and exercise can help some people manage type 2 diabetes. If lifestyle changes are not enough to lower your blood sugar, you will need to take medications. These drugs lower your blood sugar in a variety of ways. Your blood sugar level rises or falls based on the types of food you eat. Starchy or sugary foods make blood sugar levels rise rapidly. Then protein and fat cause more gradual increases. Now you are advised to work with a dietitian who can help you to design a diabetes meal plan. Getting the right balance of protein, fat and carbs can help you control your blood sugar. Now, you have to emphasize healthy foods in order to keep your blood sugar level steady. Healthy foods such